Don't assume some of these common problems that once you see you are being treated of a condition recurrently, tumbo inauma, sometimes you pass some blood in your stool, always take note and sometimes go for what you call a colonoscopy. Sometimes what you call sour throat that does not heal. Sometimes homa inaletanga sour throat, but if you are having a sour throat that it's recurrent, it's not healing, you might be at a risk factor for what you call throat cancer. So always go for a checkup. Unusual bleeding or dyscharge, especially for women. If you are having what you call bleeding that is so much, sometimes it's confused with heavy menses. But if it's so much, you are bleeding each and every time, it's so much every time, your menses are so much irregular or you're bleeding a lot, always go for a checkup. You could be having or a risk factor for what you call cervical cancer. Sometimes a lump may come anywhere in the part of your body, especially breast lump. So this is where sometimes, I think like in the month of October, you're always told it's what you call breast cancer awareness month. Always, if you have a lump in your breast, always go to a doctor, have your breast checked. Also, even what you call self-breast examination. But for those ones who are still under the reproductive age, sometimes during menstrual time, sometimes you may have a lump or you may have some breast tenderness. That's not the right time to do the examination because you might find what you call a false finding. But always check, do breast examination most of the time. Difficulty in swallowing is one of the sometimes which might indicate that you might be having a problem. Sometimes hoarseness or a cough that is not subsiding. Sometimes a lung cancer may develop with chest problems, a cough, and sometimes people may mistake it to something else. So those are some of the warning signs. We have talked about other risk factors, the likes of high fat diet. Sometimes nutrition, people are not taking proper nutrition, low vegetable fat or other fruits intake. Smoking is another what we call risk factors. Environmental changes. Sometimes people living in those what we call industrial areas, there's a lot of smoke, a lot of what we call environmental pollution. Sedentary lifestyle, people who are not able to do exercises, those are some of the things. So basically, I want to check on the last thing we want to talk about. Very important, diabetes. Diabetes is one of the conditions that affect most of the people. We have what we call two types. Type 1 diabetes and type 2 diabetes. That is, one is insulin dependent. Kuna wale unasikia watu wanajidunga insulin all their lives. And then there are those ones who are using medications. So we do have those two types, type 1 and type 2. That is, one is insulin dependent and then non-insulin independent. So basically, when you talk about diabetes, this is abnormal carbohydrates metabolism due to lack of insulin or decreased insulin. This is very important. Diabetes does not come just on its own. Especially type 2, you have had people who get pancreatitis, people who take a lot of alcohol, they get liver cirrhosis, they end up getting alcohol, or rather diabetes. So that's one of the things that you need to know about. Some of the symptoms of diabetes, we do have 3 cardinal symptoms of diabetes. We call it pyroluria. That is increased frequency in passing urine. Sometimes it's normal to have increased passing of urine, especially when the weather is cold like this. There is increased metabolism. That is very normal. But if you find that you are going to the washroom ever after few minutes, 30 minutes, na labda hata hujakunywa chai ama kunywa maji mengi and all that, that is one of the warning signs that your blood pressure, rather blood sugar, might be high. So always check your blood sugar if you have such kind of a problem. A lot of thirst, ile queue ambayo iko extra, after a few minutes unahitaji kunywa maji, you might be having your blood sugar going high. Another thing is what you call hunger. Unasikia tu ukule kila wakati, That is one of the warning signs that someone might be having blood sugar going high. So blurring of vision, unaona kama ni vimulimuli, huoni vizuri mbele, that is one of the warning signs. Sometimes poor general body weakness and fatigue, it's one of the warning signs that you might be having your blood sugar going high. So risk factors, hereditary, there are those ones which run in the family. Age, sometimes, apart from type 1. Type 1 wajua kuna, I think you have heard kuna watoto wamezaliwa wakiwa diabetic, right? So the type 1 sometimes, like kids who are born to parents who are diabetic, sometimes they have a risk factor of developing diabetes at their early age. Physical inactivity, obesity, those are some of the things we have already talked about some of the factors for high blood pressure or high blood sugar as well. So we want to say that prevention is better than cure. How can you be able to prevent some of these conditions that which we have talked about? Lifestyle. Eat well, that's one thing. Do regular exercises, that is 2. Cut weight if your weight is above your BMI. Drink less, that is in terms of alcohol. Quit smoking, it's a risk factor. Consult your doctor always when you have a problem that you might want to check on some of these things. So basically, that is all about, there's a lot we could have talked, but that is all about the lifestyle diseases. And towards this end, I return the mic to the MC. But if there would be any other questions, kindly we shall be able to answer. So I don't know whether there is that session for questions, but if there is, we can be able to check on that. Thank you so much for your time and for your listening.
Asante sana daktari. Can we appreciate the doctor for very good health talk? Now I would ask probably if there is a question that you want something clarified. Sorry, there's a bit of interference.